Good morning, everyone. Welcome to the Self-Advocacy and the ADA under COVID-19 webinar. And I think we are about to get started. So for today's presenters are Marly Saade, myself, and Carla Waring. So for the agenda today, we are going to go over some CDE services. We're going to talk about ADA basics, advocacy, ADA key concepts, scenarios. We're going to have time for Q&A, and we're going to talk about resources available. So the Center for Disability Empowerment is a nonprofit that supports individuals with disabilities of all ages and all disabilities. We are federally mandated to provide 5 core services of information and referral. So you can go ahead and call us for help to find out how to access available resources in the community. We also have advocacy, such as needing help with requesting job accommodations. We have independent living skills training, such as mobility skills training. Our youth transition coordinator supports youth with budgeting, finding a job, applying for colleges, or certain benefits. We also have peer support, and that could be either one-on-one or in a group setting, such as our Empower Youth peer group that is for youth ages 14 through 24. And then we also have transition services where we assist people who are living in long-term care facilities to transition out into community housing. We also have our youth coordinator who assists youth with transitioning into community living and housing. Now I'm going to leave it to Carla.
Thanks, Marly. Hi, I'm Carla Waring. I'm the newest member of the CDE team. Besides contributing to the CDE's core services, my primary focus is on Access Ohio project. Myself and fellow colleague Rich Wagner provides ADA technical assistance, training, and transition plan services to help Ohio businesses and state and local government with their ADA compliance questions and physical barrier removal. If you have an ADA question or want to get more information on our services, please contact us, and our phone and email addresses are on this slide. A couple other guidelines I want to discuss before we get started on our presentation is we are not lawyers. This is an information-only session, and do not treat us as legal advice. And also, there are many other disability rights laws that provide people with disabilities protection in other areas, such as the Fair Housing Act, the IDEA for K through 12 education, and the Rehabilitation Act for federally funded programs. But for the purpose of this presentation, our focus is going to be on the ADA. So I will be providing a quick overview of the ADA and some general concepts. This virus has changed schedules and work habits and service delivery systems. So when Marly and I talked about for this presentation today, we wanted to focus on sharing with people with disabilities the importance of knowing their rights under the ADA and then how to ask or advocate for those rights. I know we have many service providers attending today's presentation, so our hope is you will learn more about the ADA's advocacy and the resources that can assist your clients. Next slide. The ADA prohibits discrimination on the basis of disability in employment, state and local government, public accommodations, commercial facilities, transportation, and telecommunications. The ADA is the first comprehensive civil rights act for people with disabilities. It was passed by Congress and signed into law by the first President Bush on July 26, 1990. And this July, it's going to be 30 years old. Before COVID, CDE, along with other state and local partner organizations, were planning a big anniversary celebration. And we're still going to celebrate, but our activities are shifting to social media platforms instead of in-person events. So stay tuned to CDE social media pages to find out where, when, and how you can participate. Although there have been significant changes since the ADA was passed in 1990, people with disabilities continue to encounter barriers that affect their ability to live, work, and recreate freely in their communities. That is why it is so important for people with disabilities and their advocates to know their rights and covered entities' responsibilities under the ADA. There is also no ADA police, so to get coverage under the ADA, you need to know what it covers. You may need to ask for your rights, and in some situations have to file a written or formal complaint. Next slide. First of all, to qualify under the ADA, you must meet the definition of disability. And it's a three-pronged definition. One, a physical or mental impairment that substantially limits one or more major life activities, or have a record of such an impairment, or is regarded as having such an impairment. ADA ensures that all people with disabilities have an equal opportunity in public accommodations, employment, transportation, telecommunications, state and local government programs and services. It also includes physical accessibility requirements, and programs and services are provided in the most integrated setting appropriate. Next slide. There are 5 titles of the ADA. Each covers different areas. It is important to know when and if you encounter a discrimination, what title of the ADA applies. Each title has a federal entity that oversees specific areas, provides technical assistance, and reviews discrimination complaints. So let's quickly review these 5 titles. Title 1 covers employment. It requires employers with 15 or more employees to provide qualified individuals with disabilities equal access to benefit from the full range of employment-related opportunities available to other employees who are not disabled. It also applies to qualified applicants with a disability in the application process. You may have heard the term reasonable accommodation. This is specific to Title I and is a modification or adjustment to a job or work environment. Title II covers all activities of state and local government, regardless of size or receipt of federal funding. It requires the state and local governments to give people with disabilities an equal opportunity to benefit from their programs, services, and activities. Title III covers businesses and nonprofit providers. Public accommodations are private entities who own, lease, or operate restaurants, retail stores, hotels, movie theaters, doctor offices, homeless shelters, and private transportation services like taxi companies. These entities are covered under Title III. So basically, any business that provides goods and services to the general public must also make those goods and services available to people with disabilities. Title IV addresses telephone and television access for people with hearing or speech disabilities. This title covers closed captioning and relay services. And Title V is anything that isn't covered under the first 4 titles. This includes miscellaneous provisions such as protecting people with disabilities from retaliation when an ADA complaint is filed. Also that stricter non-discrimination laws will always apply in states that have enacted stricter or more favorable laws for people with disabilities. So an example of this is in Title I, the ADA federal law says that an employer with 15 employees must comply with the ADA. In Ohio, however, we have a state law that lowers that number to 4 employees. That means any business that has 4 or more employees have obligations under Title I of the ADA. So how do you ensure employers, state and local government, and businesses provide access, inclusion to people with disabilities? Well, there are several key concepts and terminology that help make the ADA work in different situations. Next slide. ADA hasn't changed. What has changed is this new COVID-19 environment we're living in. A question I've heard is, can ADA requirements be waived in an emergency? Absolutely not. The ADA requirement of equal access to employment, healthcare, transportation, or education services applies at all times, and most importantly, during an emergency. I'm going to talk about some important concepts, and these concepts help apply the ADA in different situations. Also, each of these concepts could be an entire training, and this is a really brief overview. So if you want more information on these concepts, please contact CDE and we can discuss your questions. So first is effective communication. Under the ADA, employers and covered entities such as businesses and state and local government must ensure effective communication and provide auxiliary aids and services to ensure that individuals with hearing, vision, speech, or cognitive disabilities can understand what is said, written, and can communicate effectively. Another concept is reasonable modification of policies, procedures, and practices. This falls under Title II and Title III. In Title I, it is called reasonable accommodations. In this time of COVID, this is an important tool to use. State and local government must make reasonable modifications of policies, procedures, and practice when such modifications are necessary to avoid discrimination on the basis of disability, unless they can demonstrate that modifying the policy or practice would fundamentally alter the nature of the activity or services offered. An example of this is a county who has a program that provides food and shelter to eligible individuals. The application process is lengthy and complex, and many people with mental and cognitive disabilities cannot complete it on their own. The county has an obligation to modify the application process to ensure that otherwise eligible people are not denied the needed benefits. Modifications could include simplifying the process or perhaps providing the applicant with individualized assistance. Physical access. Many people think ADA is a building code, and yes, there is a large amount of materials and resources regarding physical accessibility in the built environment. The current 2010 ADA standards for accessible design give specific measurements, requirements, and guidance on physical barrier removal. The point of this concept is that state and local governments have obligations to make their buildings and facilities and programs accessible to people with disabilities. And businesses are obligated to make their goods and services accessible to people with disabilities. This can include creating designated accessible parking spaces, providing ramps, adding grab bars and restrooms, and rearranging products to increase maneuvering space. There is a lot of material and checklists available to help businesses and government programs meet their physical accessibility requirements. Also, Access Ohio program here at CDE is a resource to anyone who would like more information on this. Especially in a COVID environment, effective communication, reasonable modifications, and physical access must be evaluated on a case-by-case basis. As each person is unique, so are people with disabilities, and how their disability affects them can be different. A good rule of thumb is to ask and listen to a person with disabilities. They will know what works best and is most effective for them. This is a new situation. Flexibility, being creative, and thinking outside the box may be required in individual situations. Don't have a one-size-fits-all policy. ADA is minimum standards. It's okay to go beyond the AD in providing access and inclusion. And be mindful that this is new territory for business and our government. What was okay months ago is different now and may change again tomorrow or next month. But the one thing that hasn't changed is people's rights under pandemic continues. And this is where advocacy is so important. Marly is going to review what is advocacy.
Hi, everyone. So I'm going to talk a little bit about what self-advocacy is. Advocacy is the action of representing yourself or views and interests. When to advocate, I like to say it is your choice when to speak up for yourself. And why is self-advocacy important? Obviously, it's important to create change and to raise awareness. And I always like to use two basic examples for self-advocacy. One of them is calling your cable company about the increase in $2 on your bill this month. That simple act of calling them and inquiring, using your voice and asking those questions, I would consider self-advocacy. And we all know that requesting an ASL interpreter for your telehealth appointment would also be considered self-advocacy. And it's always very important to use your voice and speak up for yourself. No one else will. And now I'm going to turn it back to Carla.
Thanks, Marly. Like many of you, I've been attending webinars that focus on COVID and have been hearing about national trends in the COVID environment. These are some examples from around the country how entities are modifying their programs, policies, and procedures. In healthcare, allowing a family member to accompany a person with disabilities in a hospital setting when they have a policy to only allow patients into the hospital. This would be an example of a modification of policy. In transportation, allowing persons with disabilities who use a mobility device to use the lift or ramp to enter the front of the bus. And that we are seeing that here in Columbus, Ohio, and CODA, who has a policy of passengers entering the rear of the bus. But if a person needs to use the ramp or the lift, the driver will allow the person with a disability that needs that accommodation to enter the front of the bus. And I'm glad to hear that they are doing that. Another example is Meals on Wheels program. They are expanding their criteria to allow people with disabilities that are younger than 55 to have access to the meals program. Another policy change is relaxing the paratransit criteria in transportation. When somebody may, last year may not have qualified for the paratransit program, but they're changing that policy to assist people with disabilities that would not have qualified in the past. And lastly, service animals have always been covered under the ADA before COVID. So a business that has a no pet policy will need to modify that policy for a person with a disability who uses a service animal. Again, these are some examples, and this is case by case, state by state, community by community. So check your local community for their new COVID policies. Next slide. Talk a little bit more about effective communication. People who have vision, hearing, or speech disabilities use different ways to communicate. For example, people who are blind may give and receive information audibly rather than in writing, and people who are deaf may give and receive information through writing or sign language rather than through speech. The ADA requires that Title II entities, state and local governments, and Title III's, businesses and nonprofit organizations that serve the public, communicate effectively with people who have communication disabilities. The goal here is to ensure that communication with people with disabilities is equally as effective as communication with people without disabilities. This means to provide effective communication is determined case by case and looking at each person's needs and situation individually. Auxiliary aids and services are devices that enable effective communication. It is always best to consult with the individual to determine what communication method or technology would be most effective for them. But when thinking about auxiliary aids and services, there are three things to consider: the method of the communication used by the individual, the nature, length, and difficulty of the communication taking place, and the complexity of what is being communicated. Next slide. These are some examples of auxiliary aids and services. Providing sign language interpretation for individuals who are deaf or use ASL as their primary language. Also, televised press conferences, briefings like Governor DeWine has been doing daily, has a ASL interpreter. VRI stands for Video Remote Interpreting. Video Remote Interpreting uses video conferencing technology to access an off-site interpreter to provide real-time sign language or foreign language interpretation for those whom English is not their first language. VRI can be especially useful in a COVID environment when on-site interpreters may be difficult to obtain. Closed captioning, like we're doing today for presentation, is another form of auxiliary aids and services. Also providing forms and material in large print and braille, or simplifying complex forms. Providing a qualified reader for an individual who is blind or who has an intellectual disability is another example. And making sure websites are accessible for people who are blind or low vision and use a screen reader. Communication boards is typically a picture board that a person can point to and explain what they need or want. The next slide is an example of this type of auxiliary aid and service. Next slide. Healthcare access. Remember, a key component of ADA is a modification of policy, procedure, or practices, and physical accessibility. Accessible testing sites is going to be more and more popular. It is important to ensure testing sites in temporary hospitals are physically accessible to individuals with disabilities. An example is a drive-through testing site. There may be a policy that this is drive-through only, but what about a person with a disability who doesn't drive or who doesn't have access to a car? They still need to be tested. So entities need to think about how they can provide access. There is a new publication developed to explore this issue and will be a link in your resource section that we'll be sending after today's presentation. Healthcare entities also want to make sure they have non-discriminatory policies in healthcare. So allowing people to have a companion or a service dog with them, even though there's a policy not to allow that. Also in an emergency environment, adhering to crisis standards of care during a resource-constrained emergency, such as COVID, is important. This ensures that people with disabilities are not treated or triaged differently. The state of Ohio has issued a guidance this month for standards of care for vulnerable populations. This guidance provides important information to healthcare entities on how to protect people with disabilities from discrimination, but more clarity is needed. So Disability Rights Ohio has responded to this and has provided suggestions in the form of a letter that can be reviewed at their website. So this is a form of advocacy that Ohio, Disability Rights Ohio is taking on for this situation. Also, language access includes auxiliary aids and services. So people with disabilities, their care providers or family members' primary language may be different than English. So having forms, materials, public service announcements written or spoken in different language is important. Also having staff train on how to use VRI technology is key to providing effective communication and translation. Next slide. We'll talk a little bit about Title I and employment. So reasonable accommodations like modification of policy and programs. A reasonable modification is a modification or adjustment to the application or hiring process to the job, an employment practice or the work environment that allows a qualified individual with a disability to perform the essential functions of the job. However, when an accommodation is not obvious, an appropriate accommodation is best determined through a flexible, interactive process. The Job Accommodation Network, JAN, is a leading source of free and confidential guidance on workplace accommodations and disability employment issues. They have an 800 hotline, excellent website, and a live chat option. As businesses are opening and employees are going back to work, it may be a reasonable step to take employees' temperatures. The important thing here is that people with disabilities are not singled out and that the employer is taking temperatures of all employees. Another example is an appropriate questions. An employer may ask the employees, have they been around someone that has tested positive to COVID? Again, this question is appropriate and doesn't violate people with disabilities rights if the employer is asking all employees, not just employees with disabilities. Medical documentation, as before, it needs to be kept safe and secure. And when we're thinking, so we're talking a little bit about employers' side. Now we're going to talk about employee side. And many employees have concerns about returning to work. First thing is to have a conversation with your employer and see if you can work something out. If working from home is going well, then ask to continue that after the office opens up. If you have underlying health concerns like diabetes or a respiratory condition, you may need to disclose to your employer about your disability and ask for a reasonable accommodation. EEOC, Equal Employment Opportunity Commission, has updated their guidance called Pandemic Preparedness in the Workplace and the ADA. Again, we will have this link to this publication in our resource page. Next, we're going to talk, so that covers the kind of the brief overview of the ADA and the COVID environment. We're going to go now to some scenarios, and Marly's going to lead us in that session.
Hello again, everyone. So I'm going to read the scenario and then I'm going to answer what you can do. Before COVID-19, you had asked for a reasonable accommodation to work from home, but your supervisor had denied your request. Since COVID-19, you and your entire office have been working remotely. At the beginning of June, your supervisor is asking everyone to return to the office. You are concerned about your safety, so you asked for a reasonable accommodation to continue working remotely. Your supervisor denied your request. What can you do? This is one of those moments where knowing your rights and responsibilities is very important. Since the entire office had been working remotely from home and productivity had not dropped, there are no reasons why your employer is not having that interactive conversation around your need to work from home. You can choose to advocate for yourself, that self-advocacy thing again.
Hello, everybody. This is Carla, and we really appreciate you hanging there with us as we're trying this new technology. So I'm going to go ahead and lead this discussion on the scenarios. So as you can see, we can read the slide. It's talking about a person who wants to continue to work at home remotely, and the supervisor has denied the request again. So again, if you were doing well remotely, I think, you know, a lot of people who didn't believe that people could be productive and work at home are now seeing that, yes, they can. And so there may be a new awareness on your employer site that allows this to happen. And let's see. And I guess the other thing to consider here is if they still say no, Maybe you'll need to disclose that you have a disability, if that's the case, if it's a disability-related reason that you want to work from home and you don't want to be in the office because you're concerned about your safety and health. So that you may have to go through the interactive process. And there's a lot of great literature out there and how to do that. And again, organizations like CDE can help navigate those issues and next steps. Also, the HR department may know more about the rights under the ADA than the supervisor. So perhaps the supervisor isn't up to date with ADA policies and guidelines, and so you may need to elevate it to another higher level to get your needs met, or to have access to a reasonable accommodation request. All right, let's go to the next one. Okay. All right. James is a college student who has a visual impairment, and due to COVID-19, all his classes were shifted to an online format. His English professor published the reading materials in a format that was not compatible with his screen reader. James reached out to the professor and informed him of the situation. But his response was that he provided James with the material, and it was James' responsibility to make sure his assistive devices were compatible with his class material. What can you do? Again, you want to know your rights and responsibilities. James asked his professor to provide a more accessible format, and the professor said no. It is not his responsibility to help with that. James knows better, though. He knows that this is not all his responsibility to make the class material accessible. So he can follow up with the professor and explain to him that he needs equally effective alternative access. And that is what is important to ask for, and at least have a conversation with James about this access. He can also go to the Disability Student Services Office, and they are all, even though people are working remotely, they are still on the job, and it's important to engage with this office at the school to assist and provide support and be a liaison between the student and the professor. So another, just an example in this situation of an equally effective alternative may be having the material read to James by a qualified reader, or have the professor record the material that's not accessible and have it recorded either himself or somebody else and provide that to James. Next slide. So Sara is a power wheelchair user. She has low vision and hearing loss, and she's fallen ill. And so to help her and husband, she spoke with her primary care physician, who advised her to go to the local hospital for testing. Her husband, Jim, drove her to the hospital, but was denied entrance due to the COVID-19 restrictions. Sara relies on her husband for communication and healthcare decisions. What can they do? So a couple pieces, a couple things that might help here is Sara could ask the doctor's office to call ahead and inform the hospital that she has a companion and she needs that companion to assist her inside the hospital. She could also call the hospital and let the admissions know that she needs a companion and that she's requesting a modification of policy. If she doesn't get her needs met with that, she may need to elevate it and talk to a supervisor or the manager of the hospital and let them know that she needs a modification of policy to allow her husband to assist her. So that's an example of what she can do. The important thing is that she needs to have equal access to communication, and by not allowing her husband to be with her, the hospital is essentially denying her equal access to their services. So again, this is where you really want to advocate for yourself and throw out the modification of policy to them. And if they know the ADA, their ears will perk up and hopefully can modify the policy to let the husband in or companion. Okay, next one. All right. So now we're getting, those were 3 scenarios that we wanted to share with you, and kind of as an idea of how you can apply these concepts in the COVID environment. So hopefully that was helpful. Okay, we're going to leap back to advocacy and kind of recap advocacy and some of the principles of advocacy, which is you need to say something. If you want to get your rights met, sometimes you need to let somebody know about that. And it's not your neighbor, it's not your parents, it's not your friends. You need to let people who can make change know that you're having an issue. And that's really important. So ask for what you need. And ask for a conversation with someone who has the power to make the change. Many times you may ask for the frontline workers, the grocery store clerk. They may not know the ADA as well as a supervisor or manager or business owner. So make sure you can talk to someone who can make a change in policy and knows the ADA and can work with you on getting your needs met. Also, you may need to communicate it in writing or an email. A lot of entities have websites and have a form that you can fill out, a complaint form or a concern form. And believe it or not, entities look at these. I used to work for a parks department, and we had a form on our website that people could fill in if they had a concern about a park. And some of these concerns were ADA related. And that was the case. They would come to me and I would look through them and try to resolve it. So they do get looked at. So do not think that they don't look at it. Many times that's just all you need to do is just submit a request or concern, and someone will get back to you. When you do that, you also want to document. So keep good records. Make sure you, if you have a situation, make sure you know the date, the time, when it happened, who was there, do you have any witnesses, anything that you can remember about the situation, write it down, because it's really easy to forget about the details. So it's important to write it down, to document it. And this is going to be helpful if you do have to raise it or elevate it and file a formal complaint. So what if the issue doesn't get addressed? What do you do next? Well, you want to talk to somebody. Again, say something. Don't just let it go. Say something. So talk to us here at CDE, for example, would be a place that you could discuss the situation, and we could navigate what your next steps are. And also, this is a really unusual environment for everybody, so be flexible and be kind. And when you're doing this, it goes a long way. People want to help, and they want to include you or your clients in their services. So work with them and be creative and be flexible and be kind. It goes a long way. Let's go to the next slide. So change doesn't happen if you don't say anything. We would like to think you can resolve it locally. It's going to go quicker and get immediate results. But sometimes you have to elevate and go to a more formal complaint process. And so if you have a Title I employment issue, the Equal Employment Opportunity Commission is the designated agency that handles employment complaints. The Department of Justice handles Title II and Title III. So any business or state and local government situations, that would be the agency you would want to be talking to and working with. Other federal departments have civil rights offices. So Department of Education, Department of Transportation, Health and Human Services, and FEMA all have civil rights offices, and you can go to them for a complaint form and information. And in Ohio, we have the Civil Rights Commission, and that is our agency here in the state to file complaints. Next slide. So maybe you're not sure whether it's a Title I, Title II, Title III, not really clear if this is even an ADA issue. Well, the first place to check is the Center for Disability Empowerment. We can talk to you about your question or concern or situation and let you know, give you some guidance and assistance to find out which disability rights law applies. Because as we said before, there's several disability rights like Fair Housing Act, IDEA, the Rehab Act, Air Carrier Access Act. There's tons of laws out there. So maybe we can help you figure that out. There's a you who may not live in our 4-county catchment area. There are other independent living centers around the state, and we can help you find that out. If you don't know if you have an IL, independent living center in your area, we can assist you with that information. Also, a good place to go is Disability Rights Ohio. They have a website. They take telephone calls, and so they have a lot of information that might be helpful. Also, if you have a service coordinator or a case manager, a social worker, or somebody maybe who's on this line, now that you know a little bit more about the ADA, you'll be able to assist your clients in the next steps. And another great resource is Great Lakes ADA Center. They serve Ohio, and they have a 1-800 number, toll-free, and they man it Monday through Friday, and you can call them and talk with them about the situation, and they can help navigate what your next steps are. Okay. We are running out of time, so we're going to skip the questions and we're going to go right to one. Well, actually, we're going to let's go back to we did get a question that came in from an attendee who's wanted us to talk a little bit about masks and face coverings. And the question was, would conditions such as autism or Down syndrome count as exemptions? And the second part is, the employees required to provide medical proof of condition in order to be exempt from wearing a mask, thus disclosing their medical condition. So ADA doesn't call out specific disabilities like autism or Down syndrome. It keeps it broad and talks more about not wearing masks because of health reasons. It also depends on the situation. If a person can't wear a mask, they may need to be creative on how to get what they need. In an employment situation, they may need to ask for a reasonable accommodation. And in that case, if it's not obvious, they would have to disclose they have a disability and provide reasonable medical documentation. CDC recommends that masks be worn to protect the safety of employees and customers, provide a strong support for the unreasonableness of allowing customers to enter a business or work without a mask. But the ADA also requires a business to consider reasonable alternatives to access that would not require the customer to wear a mask. For example, instead of allowing a maskless customer shop in its stores, a business may take phone order and can be placed in or on a customer's car or in an outdoor pickup area for contactless exchange. Businesses should consider alternative means of providing access to their goods and services in advance, so employees can be trained to offer those alternatives to individuals who ask to be exempt from the mask requirements due to their claimed disability. Also, we have a Governor Stay Safe order, and in it, there's a link here on the screen. We'll have that as well in our resource section. And on that order, number 8, it provides reasons an employee may be exempt from wearing a mask. And one of those exemptions is facial coverings are not advisable for health reasons. So if you need some written information there where it says this is an exemption, this is a good place to go. Okay. Also, there's just tons of information right now. The EEOC is got a lot of information on their website around this face covering issue. So I would also encourage you to go there as well. Next slide. All right, we talked a lot about resources, so we're going to go through some very quickly. The ADA National Network, there's 10 regional centers around the country, and like Great Lakes is our regional center here, but each, they are a collective, and they work together, and they do a lot of fact sheets, and they have a lot of information on different areas of the ADA, and they also have a COVID-19 resource section. So we made a screenshot of that. They also have webinar training, and they're actually having a couple good trainings coming up next week. On the 26th, they're going to have effective communication, and on May 28th, we're going to have a 90-minute presentation on emergency preparedness. So they do a lot of trainings. If you can't make the trainings, they're all archived, and you can listen to them when you have the opportunity to. And they, again, offer technical assistance. And that's as a national hotline, and I really recommend giving them a call. So again, just to review some other technical assistance and resources, we here at CDE and Access Ohio can be a place to start and to begin your journey on this in this area. There's also Great Lakes ADA Center and Disability Rights Ohio. Some federal technical assistance agencies are the Job Accommodation Network, JAN, that deals with Title I, and any accommodation question can be answered by them. And they have a great website, so I encourage you to go check that out. The DOJ, Department of Justice, is for Title II and Title III concerns. They have a hotline, and they have a lot of technical information and materials that you can check out. And again, just like DOJ, EEOC is a federal department that handles the Title I issues. Again, they have a hotline and lots of great material. Next slide. So some specific COVID resources, the CDEC is a great place to go. FEMA has a whole section on COVID related resources. The Ohio Department of Health has a resource section, and as well as Disability Rights Ohio. And the last, I'm going to go back to that last slide, please. I did want to note this guide to temporary events. It's from the National Network website. You can get this. And this is a good guide for physical accessibility for temporary events, and maybe useful for pop-up testing sites or temporary hospitals to know how can you have a temporary event but make it accessible. So with that, thank you. Well, thank you for attending our session. This last few slides are CDE's information on our social media, and we have a lot of we have a website, we have Facebook page, Twitter, Instagram. So please check us out on social media. And the last slide is, again, some more general information about CDE, where we're located, our phone number, and website. We are working remotely, and so we really appreciate you leaving voicemail, and someone will get back to you.
In that case, if you guys do not mind, we do have a polling question for a next webinar. If you don't mind taking it and letting us know what topic you would like for next time, that would be greatly appreciated.
Great. Yes, we'd like to continue these discussions and webinar format. As you know, this is our first one, so we had a few hiccups, and hopefully, though, the information was interesting and informative. Again, feel free to call us with more questions or to get more information. We're also going to be following up with a SurveyMonkey for an evaluation and providing registrants with a resource list and links that we noted in the presentation. So stay tuned for that, and thank you all for attending.